Well, people ask me all the time, how do I look better using regenerative medicine or without, invasive procedures, without a facelift or using fillers and Botox? Well, there's a place for everything, and it really depends. I like to see us start younger, doing things to help maintain healthy skin elasticity. People hear every day, well, you don't smoke or quit smoking. I can't tell you enough how I can just pick out people walking down the street and tell who the heavy smokers are. It is terrible, particularly where we live at altitude from sun damage. Smoking and nicotine is a powerful vasoconstrictor. And so, as we constrict chronically the arteries supplying nutrients that we eat, micronutrients that we eat, take, ingest to the skin is less healthy. It's gray, it's ashen. You have, it's very easy to see the difference. And so we'll certainly start with that. Different regenerative techniques that work very well are one, depending on your age, am I doing everything I can to balance hormones? Am I eating healthy? Am I staying away from oxidation, oxidative stress, oxidizing substances like nicotine, too much alcohol, drug use, etc.? And so it is more of an individualized type of plan in looking at, all right, what can work best for me, for you as an individual? Certainly, you may have heard of platelet-rich plasma, where we use the growth factors from your blood, spin it, separate it, draw some blood first, and then use it through injections subdermally and topically with microneedling techniques. The growth factors there can produce very nice results with an overall healthier, more radiant skin. We use exosomes for facial rejuvenation. Exosomes being all the nanoparticles of information, if you will, from stem cells, all the messengers that trigger healing, are extremely powerful, much more powerful than using our own platelet-rich plasma to produce very desirable results, improving collagen formation, treating fine lines and wrinkles, and those factors are also treated from the inside out, so to speak, as we do hormone replacement. It helps to stimulate better collagen formation, better vascular health, better endothelial health of the microvasculature throughout your face, through the skin. And the same for scalp and stimulating hair growth. We use both of those types of treatments. So there are a number of things that can be done. Initially, eliminating environmental stress and toxins is without a doubt the most important thing, and really bringing health to you and beauty from the inside out, if you will. So the benefits of regenerative aesthetic treatment, if you will, are really many. They're having a healthier, more radiant skin. It just shows, it just kind of shines. Platelet-rich plasma is very effective. And, who's a candidate? Well, everyone's a candidate. It just depends on your age, the degree of sun damage you may have, depending on your hormone status as well. And so on younger patients and with, let's say, less significant skin damage, as we age, we start seeing the effects of all those years of sunbathing without sunscreen and darker spots in the skin come to the surface. There are a number of different issues that can affect us individually. And so we just have to address it individually. It's like, all right, it's just a little platelet-rich plasma with injection and topical use, then microneedling to really bring some vibrancy back to the skin, may be great. With more sun damage, more deeper fine lines and wrinkles, then we would look at stem cell therapy and or exosome therapy. With both work extremely well to provide even more growth factors than we have in our plasma. And then using a good skin routine, a good regimen of products. We currently handle the #1 K beauty brand in America, in the world, from South Korea, Remon, and I found it to be better than our own skincare line. And in the past, I've owned medical spas, several in Dallas, and have used a number of different compounds and companies that I won't mention now, but you're certainly familiar with. They're in most every medical spa. And I found these to work extremely well. And so, a little prevention, looking at overall health, picking something that fits your budget and matches what someone may want to do now versus what we may need in 5 or 10 years from now. So it really depends on the assessment in matching the best treatment to that. And so really am I a good candidate? Anyone that has a face, anyone that's interested in maintaining your beauty, maintaining your vibrancy, having, an attractive appearance, fighting those lines and wrinkles that ultimately happen with age, as I said, putting the right stuff in. Beauty starts from the inside out, to getting a full assessment of what can be done. And if you're interested, just click on the link, in the video here. Take a look at our website, schedule a free telemedicine consultation, and we'd be happy to help steer you in the right direction.